As we remember, ARIEL3 was a placebo-controlled trial in all comers in the platinum-sensitive maintenance patient population. So patients would have had to receive a platinum doublet and had a partial or complete response, and then were randomized in a 2-to-1 fashion of Rucaparib versus placebo. In that patient population, we had a pre-specified non-BRCA homologous recombination repair genes. As you hear, it's hard for me to say homologous recombination repair genes, so I will refer to them as HRR genes. These pre-specified non-BRCA HRR genes were evaluated also in the ARIEL2 trial. What we know is that in addition to BRCA, RAD51C and D, as well as BARD1, BRIP1, and PALB2 are significantly associated with hereditary ovarian cancer. We've also found that PALB2, RAD51C, and D are causally associated with clinical sensitivity with PARP inhibitors. And so our goal of the research presented at SGO was to analyze our post-progression outcomes to evaluate the continued benefit of Rucaparib therapy in this subgroup of non-BRCA HRR genes.